Hey everyone, welcome to our regularly scheduled research update Facebook Live and apparently on lots of other platforms as well. We get together twice a month, usually the first and third Thursday, that I'm looking at recent papers that have come out, and they're papers and studies that have to do with lipedema, and I'm just telling you about them, and I will show you where to get them if you want to read them yourself. Today, I got a really good paper about hormones and lipedema that I want to go over. But first, I want to just answer a couple of questions I got from the Facebook Live or the paper review that I did last week. And last week, it was about our paper that we at Lipidemia Project and several other experts in the lipedema community, we did a paper, a proposed framework for research case definitions in lipedema, and specifically a definition of lipedema to be used for research. But people were asking, well, how is this going to help the patient? And it is going to be so helpful for the patient, really game changer for the patient in several ways. One of the ways is that we're going to have stronger research because we have this framework in order to make sure that we get people who have lipedema in studies, and then we can do research on them. But the other thing that is actually going to be useful with this paper is that this paper describes lipedema in such a way that the clinician can now diagnose, or the clinician that maybe has never even heard of lipedema, they can read it and understand what this condition is. It is really well written, and I think that it's going to make the diagnosis of lipedema understandable to the clinician, and also they're going to be able to take this paper and use it to help them diagnose their patients. So this is going to be a great paper for you to take to your doctor. So I hope that answers that question about this paper that I talked about last week. Be sure and continue to post things in our chat about any other comments or questions about previous papers that I've discussed or the paper that I'm doing today. Also, you know how I love for you to post where you are in the world and maybe what the weather's like where you are. So be sure and let me know you're here and where you are. But let's get now to the paper we want to talk about today. And many people are talking to me about hormones, and they want to know, should I do hormone replacement therapy? Should I take contraceptive pills that have hormones in them? What happens if I'm being treated for, like, for instance, breast cancer, and they give me medication that stops my hormones? So there's a lot of questions around hormones and lipedema. This is a great study that begins to answer the question. I have to repeat that because we get some information out of here, but it's not the end of our study of this question about hormones and lipedema. This is just one study. It gives us some more things to look at, but we don't have definitive answers yet. But I hope that it will help answer some of your questions about, well, what should I do for myself right now as far as hormones and if I have lipedema. So you can see posted right there, the title of the paper is called Observational Study on a Large Italian Population with Lipedema, Biochemical and Hormonal Profile, Anatomical and Clinical Evaluation, Self-Reported History. I don't know how they come up with these long titles, but this is basically, it is looking at hormones and other blood markers is one of the things they were looking at. They looked at a ton of stuff in this study. And it was written by several researchers and clinicians in Italy, including Roberto Canatero, who he spoke at one of our previous heart-to-heart events. So it does a lot with lipedema and nutrition in lipedema, specifically looks at a ketogenic diet. So I was nice to see that he was on this paper. And it was published in the peer-reviewed journal, International Journal of Molecular Sciences, in January of 2024. So what they were looking to do with this study is that they were trying to describe the clinical, instrumental, and blood test results of a large population of women affected by lipedema in the lower body. And so what were the methods they used? Well, it was retrospective, meaning they were looking back at charts And it was an observational study. So there was no intervention in this. They were looking back at charts and seeing what the clinical picture was of women diagnosed with lipedema. And they had 360 patients that were diagnosed with 1, 2, or 3 stage of lipedema in their lower body. And they were all patients that were at a particular lymphology clinic in Italy. So they came up with a lipedema diagnosis based on the clinical findings of the characteristics, signs, and symptoms of the disease. Again, it would have been great if they had our paper about that was showing what the actual definition of lipedema was, so that we can have all these studies. You want them to be using the same definition of lipedema. It makes our research even stronger. But they completed the study before our paper came out. And all of them, besides doing the extensive clinical exam, they did patient history, they did actually ultrasound, and they also did blood tests. And so let's look at the results. So just some characteristics of the patients. They had, as I said, 360 women. They all had lipedema in their lower body, and their age range was from 12, interesting, 12 all the way up to 76. The average age was 40. And they have 40% of the participants were stage 1, which is kind of cool because sometimes we're not getting a lot of stage 1 patients in our research. 40% were stage 2 and 20% were stage 3. And as seems to be common with most studies on lipedema, is that type 3 was the most common type of lipedema represented in the participants. And that type of lipedema means that the affected tissue is from the waist to the ankles. And then interestingly, and this is coming up more and more in papers, 55% of the participants also had lipedema in their arms. And it was used to thought that in your arms was more rare. And now we're seeing that, no, this is much more common than we realized before. Then we're looking at when did the lipedema start? And this is, again, something was written down in the chart and as best as they can remember. And the authors even made a comment that a lot of patients tend to put when it really took off and it really got bad, and not necessarily when it started. But they still, from this study, they found that 58% reported that the onset was at puberty. They actually had, though, at least 23% said that they noticed stuff before puberty. So that's pretty good, because sometimes when it really takes off is at puberty and you don't notice that, no, there was something going on even before that. So that was good that the participants caught that. 16% said it was after puberty, and then just over 3% said it coordinated or it coincided with perimenopause. So now let's look at those exacerbations and triggers, those things that made it even worse. And so one thing that the participants had noted that was in their charts was that weight gain really made it worse. And that was a trigger for 54% of the 360 participants. Another 53% said that it got worse with pregnancy and breastfeeding. That's interesting because sometimes we're seeing, at least anecdotally, that breastfeeding tends to be something that calms it down a little bit. Pregnancy, yes, makes it worse, but calms down a little bit with breastfeeding. Not this one. It was both of those things seemed to make it worse. And then get this, 44% said it really took off when they took contraceptives. So contraceptives that used hormones. So not, the mechanical type of contraceptive. So then let's look at, for at least the older participants and that had had it for quite some time, what was the progression like? What's that picture look like? And they said that most participants worsened over a period of years, and that it was either very, very gradual or it was a sudden increase in a response to 3 things. Actually, they said either hormonal contraceptives, pregnancy, or increased weight. And so that could be usually was a sudden exacerbation, but a lot of people also had just that gradual worsening. And then interestingly, they also had noted that the participants that noticed a problem with using hormonal contraceptives, they saw that the symptoms receded quite a bit when they stopped using those contraceptives. But if there was excess fat tissue that had built up in the lipedema areas, that did not go away with no longer using the contraceptive. And then the three most common symptoms associated with lipedema that the participants noted, 100% of the participants had pain. That was the most commonly reported. All of them had pain. And then interestingly, I had not seen this before, but 99% had subcutaneous nodules that either they noted or the clinician who was assessing them and palpating, they could feel the nodules, 99%. And then another 94% had fat pads just above their knees. I was kind of astounded at the high frequency of each of these symptoms. So those were the most commonly reported. Now let's go to the blood tests. And I think, and I have to really look at this paper even more for even more detail, because there was a lot that they did with the blood tests. And I just did, my first pass to tell you about this paper. There's I think a lot more to be discovered as I more carefully look at this paper. And again, that link for the paper will be below. If you want to look at this more carefully yourself, click on that link. But in blood tests, they did what's a CBC, a complete blood count, and they really found no differences between stages or BMI or age, or whether or not there was obesity present among all those 360 women with lipedema. They did not find anything major in differences in the CBC, in the liver and kidney function tests, in electrolytes, or in total protein. Those seem to be about the same in all ways that we could group these participants. But when it came to inflammation, they did a couple of different measures of that. One was CRP. And so in that one, the participants, interestingly, the ones that had their arms also involved had higher levels of the CRP, as well as a couple of other blood tests that they did for inflammation. I was checking to see if it was also the ones that also had obesity, but they didn't say that. I think I only got the most important thing on this one with inflammation. It seemed to be much, much worse, or at least it had a level of a significance for those that had arm as well as leg involvement. And looking at the lipid panel, 47% had what your doctor probably calls dyslipidemia, and that is an abnormal lipid panel. This is not lipedema. It has to do with your lipid panel. And so for those people, they had high total cholesterol, high triglycerides, high LDL, and low HDL. But even though they had what we consider dyslipidemia, they were still, if you matched these people for the participants for others in the general population for BMI, they were lower than the general population. So they were not as dysfunctional in lipids as the general population. Then glucose panel. Okay, so glucose metabolism. There was some alterations in glucose metabolism. That was in fasting, hyperglycemia, so high levels of glucose, even though you're fasting, and fasting insulin resistance, and also glucose tolerance, because they did an oral glucose tolerance test. And overall for those was 39% had this altered glucose metabolism. And it seemed to be higher, more often it was experienced with the people in the later stages of lipedema. But overall, there was a lower incidence of diabetes. So we are having the beginnings of some problems with glucose metabolism, but frank diabetes was a very low percentage, which that seems to match what other studies are saying. And let's see, but the authors did wonder if the presence of insulin resistance could contribute to triggering or worsening lipedema. It's one of those areas that they thought, let's look at this further, let's study this more. And then they went on to look at insulin-like growth factor 1, and the levels were lower in later stages when the arms were affected and if obesity was present. That was interesting. And lower levels of this insulin-like growth factor, actually, that's what's experienced typically when there's obesity. And so it was lower levels as we progressed through the stages of lipedema, and if there was obesity and the arms were affected. And then vitamin D. Oh, this one was really interesting. Vitamin D, 85% of the participants were deficient in vitamin D. And I had seen that there was deficiency in vitamin D in other studies, but not this amount. This was pretty high, 85%. And interestingly, though, this kind of matches the female Italian population that is over 70. So say you're that 12-year-old in the study, and I don't know what her vitamin D levels was, but say you're 12 and you have the same as a 70-year-old woman in Italy has as far as vitamin D levels. So for that reason, the researchers said this is something that really should be tested on all of our lipedema patients and be able to address that. And they're wondering if some of the symptoms of low vitamin D are pain and also fatigue. And so could this be exacerbating those pain and fatigue symptoms that we already have with lipedema? So really interesting. Thyroid function. Well, we know that we often see hypothyroidism in lipedema, and this study was no different. Their results were about 30%. It was higher than the general population, but a little lower than some other previous studies in lipedema had been. But they also looked at autoimmune thyroiditis, and not very many studies had looked at that in lipedema. And of the hypothyroid cases, 56% also had autoimmune thyroiditis. And so this is an area of concern that should be looked at with each lipedema patient. Also, interestingly, hypothyroidism is more common in participants was more common in the participants who also had obesity, but the incidence of hypothyroidism did not get worse with increased BMI, increased higher stage of lipedema, or when the arms were affected. That remained relatively stable, but it seemed like if there's obesity versus no obesity and just lipedema, then it was more often that they were going to have to be hypothyroid. Let's look at the ovarian and adrenal hormone profile. Again, like as I said, they looked at a whole bunch of different blood levels. And interestingly, they said there was no significant alterations with a variety of ovarian and adrenal hormones. They looked at prolactin, cholesterol, ACTH, gonadotropins, estradiol, progesterone, and more. And the results were really compatible with, if they were still menstruating, it was compatible with what where they were in their cycle, or it was compatible if they were in menopause. So nothing unusual there, but they did have an increased incidence of what's called hyperandrogenemia. So those androgen hormones that were in the blood. And so there was a hyperandrogenemia, which means an elevated level. And it was higher in this study than it was in the general population. So this is something that could be an abnormal balance between androgen and estrogen. And so it's something that should be looked at. They're saying maybe this is part of what that imbalance could be triggering or exacerbating lipedema symptoms. So worth looking at. And also the fact that males who have lipedema, the few that have been reported in the literature, they have hypogonadism. And so it is also these same alterations in these same hormones are seeming to cause lipedema in males. So something worth studying. And then other comorbidities with lipedema. Was some new ones. I mean, I've learned a lot of papers about what are other conditions that people with lipedema have. And this one had some new ones in there. It talked about some menstrual alterations. So having longer and heavier periods, having polycystic ovary syndrome, having fertility problems, eclampsia. This is a problem during pregnancy, gestational diabetes. That's also with pregnancy, miscarriages, endometriosis, various allergies, headaches, mood disorders, and GI disorders like IBS. So some of those I'd heard before, but some of them are new ones that I had not heard before of people having a high incidence of. 33% of them had joint hypermobility, and this is something we do see often. Metabolic syndrome was actually a lower incidence in this study, as it has been in other studies. And obesity was just under 40% of the participants, and that is also lower that's seen in other studies. And as they got to later stages, the obesity was much more common. So really interesting paper. And like I say, I barely scratched the surface of this paper. So if you want to follow that link and read more, you certainly can. The authors didn't say it as a limitation, but I think that they recognize that this is something that can be done better. And that was, they need a larger population. Even though they had 360 participants, they want more, and they want them to be more similar. Each participant to be able to have a large grouping of very similar participants, exactly what we're trying to accomplish with our case definition paper, so that you clearly can put people in various categories and really do some good research on them. And then they said there were just some of the things that they were looking at, there was just such wide variations that it could make it really problematic for making a conclusion. So the more we can carefully identify our participants and make them similar to lipedema participants that are also being studied in other projects, then we can really get good information. So conclusions. They conclude that with a higher incidence of comorbidities and worse endocrine metabolic profile, so that's associated with higher stages of lipedema, a higher BMI, and interestingly, when the arms are affected. So they tend to have that worse metabolic and hormonal profile at the same time. And so they really suggest that we need to not only do a clinical examination of our patients, but such as like fat and fat nodules and pain and all that kind of stuff. We also need to study blood work. We need to get more information about blood work. We need to really follow things like if they are low vitamin D and make sure that's being taken care of. And so they're saying we should look at lymphological issues, vascular issues, endocrine and metabolic issues. All of this will be a more holistic picture of the patient. And as we're learning also, we need to also be following and making suggestions for mental health too, to make sure that the whole person is being helped. So this study really gives us, it increases our knowledge of that clinical picture of a person with lipedema, and what makes it more severe. And maybe it's going to help us understand how to, what kind of things to follow on our patient, how to do better interventions. And so I think this is a really nice contribution to look at that blood work. So let's talk about that some more. And I really would like to have those things be addressed in a way that is going to work better to forward our research in making solid science with how we help to identify and manage lipedema. And that's going to be done by contributions like with this paper coming out of Italy, but also by having a clear definition of what lipedema is, as we were able to get to work on with our recently published proposed framework for research case definition of lipedema. Remember that that paper can be used. You can take it to your doctor's office, and this can help your doctor know what to do for you. It can help them identify and diagnose lipedema, and it can help guide them to giving you better interventions and managing your condition. So make sure you check out that paper and download it. Use that link below. I'm just going to really quickly look through here because I see a lot of people posting. Anne is in Quitman, Texas, and she says it's 82 degrees. Very nice, but having thunderstorms later. We have a Facebook user in Wisconsin, and Mara Lee says hi, and Esther is here from Oregon. And so Esther also says, high unopposed estrogen in the system for a period of time can negatively impact thyroid function and cause autoimmune thyroiditis, nodules, and cancers. And all these are present for me, says Esther. And so it's not only identifying those hormones that are out of balance, but how they're interacting and causing imbalances with other hormones, Esther. And so thank you for pointing that out. There is a lot for us to study about blood numbers and hormones. Kathy says, good morning. And Sandra says, thank you. And we need U.S. blood test research. Yeah, so this was wonderful looking at the Italian population. And it sure sounds like they have a problem with vitamin D deficiency in Italy, more so than we have here in the U.S. But yeah, we need to get all over the world. We need to have looking at those blood numbers with lipedema. Kathy says that it's 10 degrees Celsius in Adelaide, South Australia. I'm not sure what that is for us in the U.S., but thank you, Kathy, for giving us that report from Australia. And Kathy also says, having had estrogen and progesterone positive, HER2 negative breast cancer, you kind of see how this might fit in with your lipedema, because these hormones all have impacts on various parts of our health, right? And various conditions that we have. So how can we make them, help them be balanced in such a way that we're going to be healthy overall? So thank you for everybody who posted and participated in this. And if you are watching this on replay, remember that we have the links down below, not only for our paper, which is a proposed framework for research case definition of lipedema, but also this paper I was talking about today, linked below. And you can read more on all those topics, print them out, and take them to your doctor. So that is all for today. Thank you so much for being with me, and I'll see you next time for another research update. Bye-bye for now.